Greetings, and thank you for joining us on this insightful program on life-saving and life-changing role of telehealth in mental health services. I am Pat Meriwether Argus, Executive Director of Project Patient Care, and I will be your host for this program. This is an important and timely meeting today as we highlight the value and growing and importance of telehealth. Telehealth, telemedicine, and related terms generally refer to the exchange of medical information from one site to another through electronic communication, and it's all done to improve a patient or nursing home resident's health. In this critical time when we are confronting COVID-19, and in normal times, telehealth is turning out to be a lifesaver for many people. Telehealth is a source of ongoing health service support in an environment where we have a shortage of physicians and clinicians, and also when patients or residents are physically unable to make an office visit. We are very fortunate to have with us today Wendy Hayum Gross. Wendy is a licensed clinical professional counselor and co-founder and co-owner of Grow Wellness Group in Naperville, Illinois. Wendy has over 20 years of experience as a counselor, working from a strength-based, positive, and affirming perspective over a range of issues. She is an integrative therapist utilizing a variety of methods to best address each client's individual needs. We will explore with Wendy how she is using telehealth to effectively communicate and interact with patients that have transitioned from face-to-face conversations but are now turning to telehealth. Wendy, why did you decide to offer telehealth? Was there something that prompted moving from office visits to telehealth?
That's a great question, Pat. I actually have had the ability to use telehealth in my practice for many years. We have a HIPAA-compliant platform, electronic health record, and I have used it time and again. Someone has a sick child and they can't come in, or maybe an accessibility problem getting to the office, but it was very far and few between. And then when we started with the COVID crisis, everything changed. And I was actually very lucky that we had this system that was had cobwebs on it, rarely used. And we pulled it back out. I have to say that the major insurers in our area supported this by increasing accessibility to their clients and members to use telehealth. And then we truly pivoted on a dime. We went from 1 week seeing clients in our office to the next week, everyone was on telehealth. It allowed us to continue therapy, continue working with people, but safely. We weren't adding to their stress. We were alleviating it. So it really was a wonderful point of access.
Wendy, I know that you typically have interacted with your patients or clients, and it has been in an office setting. How do you make them feel comfortable to open up and interact with you in your office?
So the office is designed to make people feel at ease. If I could show you my office today, you would see 3 separate small seating areas, very intimate, almost like someone's living room or family room. We have coffee and tea and hot chocolate, therapy dough on the tables, pens and paper, and hard candy that you might have found at your grandmother's house sitting on a table. We try to make it feel comfortable. It doesn't feel clinical. It doesn't feel medical. Again, kind of an extension of your home. And we play soft music in the background, and our offices are infused with a lavender scent. So we're really reaching out to people's 5 senses to help them relax. We are making them feel welcome and doing as much as we can to reduce any stigma that may still linger with people about seeking help for mental health care.
Wow, Wendy, that is great. I mean, I almost feel like I want to come there and just relax and just share and have a good conversation. Now that you've moved to telehealth, you don't have that scent, you're not having the 5 senses, but how are you making people comfortable so that they open up with you and can have a face-to-face virtual session with you?
You're right. It was a challenge when we pivoted and made the move from our offices where we don't have to think about how to make people feel comfortable. It's designed to make people feel comfortable to this new digital platform. So I think one of the first things we did is we shared with everyone that it's going to feel weird. It's going to feel unusual. It's not going to feel like sitting with us. However, once we start talking, just as today you and I are talking, the sides of my computer screen disappear. I'm looking at you, you're looking at me, and we're connecting. And so I think that was the biggest thing, was letting them know it's going to be different. It's going to feel unusual, but it's going to be okay. And it is funny. I can't simulate all the things that we did when we were in the office, but I still often have a cup of coffee or tea with my clients. And I almost think we have an opportunity here. Before, although we tried very hard not to be clinical, we were, because that's why people came to our office. Now I'm inviting you into my home, and I'm being invited into their homes, and I'm getting a greater understanding of what their lives are like, because I can not only hear about it from them, but I can see it, and they can see mine. And I think it's opened a whole new understanding. And really, when it comes down to it, therapy is growth and development, and the wellness comes through the relationship. And if the relationship is deeper, then the wellness comes quicker.
You mentioned that the connection. And I suspect our audience is saying, well, how do I connect? Do they need special equipment or any software that has to be used? How do they connect?
So there are different ways to connect. And of course, we need to most importantly do what makes people feel comfortable. As I mentioned earlier, we do have electronic software that we use. It's cloud-based that has a HIPAA compliant video plugin, for lack of a better word. So just like we're talking today on a secure platform, I can talk with client or clients, because couples therapy works this way also. So that's the first thing. Now, at the client side, for me, I usually use my laptop. It's the easiest thing. Clients can choose to see this on either a laptop, a tablet, or a phone. So it's an app actually on a telephone for them. Also, there are people who, I mentioned, like we see in each other's homes. Again, realize there are some people who probably don't want us seeing in their homes. And for those people, we use an audio platform, again, HIPAA compliant, but without pictures. So we can, again, meet people where they feel comfortable, because therapy, again, does not work if you don't feel comfortable.
It's so easy, and it's so economical and so efficient for both sides. Wendy, I know that COVID-19 crisis has kept some people away from visits. And now with the senseless racial killings followed by protests, it have an increase in anxiety and depression among people. The opioid death rate in the first 5 months for Chicago has doubled from last year and is on the increase. Are you seeing more patients with increased anxiety?
Absolutely, Pat. I'm seeing increased anxiety, depression, isolation, anger, loneliness, grief, the gamut of emotions. And I would say the acuity of the clients that I'm seeing has increased also. Just in the past couple weeks, I have had more clients go into partial hospital programs or intensive outpatient programs, because once or twice a week talk therapy was not enough to help them with just the level of feelings they were having. So what we're experiencing now, you talked about COVID, racial inequality and injustice, just the difference between having and have not. This is trauma. It may not be the trauma that we think of that's associated with war, but it is trauma. And those who are working through the trauma, talking to someone right now, will be far in a better place when all this calms down. And everyone who is not working on it, is the best way I can say it, not addressing it, understanding it, contemplating it, understanding what it means to them, will have far more symptoms of trauma later on, which come out as physical ailments, anxiety, some of the ones we talk about, but also in many other ways in our relationships with people, trust, things like that. So I think the acuity for everyone has increased. The anxiety for everyone has increased. It's no longer a mental health problem, but it's a community or a human problem. And I guess the other piece I want to say is the unemployment. I don't know if you mentioned that, actually, I can't remember, but the unemployment that is affecting people. Matter of fact, right now, probably about 25% of my clients are either furloughed or have lost their job. And in our practice, we're continuing to see them whether they have insurance or not, because again, we talked about relationship. We have a relationship and a responsibility to continue to see people pro bono, because if nothing else, in this field, we are helpers.
Thank you, Wendy. And it's just amazing, again, how your practice has expanded, but you have never forgotten the patients, because those are the ones that you're supporting now, whether they're on furlough or unemployed. The caring, the compassion remains. So thank you for what you're doing. It really is outstanding and such a need right now. Wendy, do you see yourself continuing to use telehealth after COVID-19, the social injustice crisis that we're in passes? And if yes, why?
Well, Pat, the answer is yes. Yes, absolutely yes. Using telehealth increases accessibility. And whether that is for someone who is less mobile or someone of an older population or someone who has a really busy lifestyle. I see so many people with children and working and e-learning, and there isn't an hour in the day. We tell them to have self-care and they don't know where to even put that. So telehealth allows us to make it more accessible and easier for people to have services. So I see telehealth moving forward as a very economical, both in time and finances, and a viable way to reach out to more people and to allow us to have a deeper impact.
Wendy, I also agree with you. I think telehealth is going to continue, and it just makes it more accessible for people, working people that maybe during the day can use it, as well as those in crises. Again, it's an amazing resource that we have available. Is there anything else that you would like to add, Wendy, before we close?
There is actually something I'd like to add. Two things, to be honest. The first one is, if anyone out there is thinking that maybe they should talk to somebody, if you're already thinking that, then yes, you should. And there are wonderful ways to get connected if you don't have someone to talk to, resources. Google is our best friend. See what's available near you. Also, I think we need to think about how we categorize mental health. So if your kidneys don't work, we send you for dialysis. If your brain isn't working the way that you want it to or it should, why not reach out to get some help? And mental health, physical health, it's all connected. There is no special borderline where, this is only mental health or this is only physical health. We are complete people and we're connected. And again, I think the telehealth piece is helping us see that whatever organ needs some help, we can address it. So I just would encourage people to know that if they're not feeling like themselves, they're not feeling well, that there's hope. And you can feel better again. It just takes a little bit of work and you might have to reach out.
Well, thank you, Wendy. And again, it is so important during this time that people do reach out and not feel that they're unique, because everyone is feeling this. Everyone has some level of anxiety and certainly depression as well. Thank you so much. I know you're a pioneer in advancing telehealth and counseling and psychotherapist sessions and really providing the lifeline that many people need right now and in the future as well. So thank you, Wendy.
Thank you so much. I really appreciated talking to you today and having the ability to share more about telehealth.